Dealing with a toothache and just can't get to the dentist right away. We've all been there, and that pain can be unbearable. But don't worry, you don't have to suffer in silence. A toothache, though small in scale, can command your full attention with its sharp, throbbing pain that seems to never end. It's one of those discomforts that can disrupt your entire day, making it hard to focus, eat, or even sleep. Toothaches can arise for various reasons, such as cavities, gum disease, or an infection. While it may start as a minor irritation, if left untreated, a toothache can quickly escalate into a more serious dental issue. In this video, we'll reveal to you 8 simple, effective home remedies that can help ease the pain until you can get professional care. From tried and true techniques your grandma might have sworn by to quick, science-backed solutions, we've got you covered. So if you're tired of that throbbing pain, stick around. We're going to help you feel better fast with things you likely already have in your home. Number 1. Saltwater rinse. Did you know that a remedy as simple as mixing 1/2 teaspoon of salt into a glass of warm water can cure your toothache? Swish this mixture around in your mouth for about 30 seconds and spit it out. This can help reduce inflammation, kill bacteria, and remove debris from the affected area. You can even do this several times a day, especially after meals, without fearing any side effects. Salt water is effective in treating toothache because it is a natural disinfectant and can help to reduce swelling and clean the area around the tooth. All these characteristics make it ideal for providing temporary relief from pain, and the mechanism by which it accomplishes this miraculous work is rather simple. Salt water is a hypertonic solution, meaning it has a higher concentration of salt than the fluids in your body. When you rinse with salt water, it creates an osmotic gradient that draws excess fluids out of swollen gums and tissues, reducing swelling and pain. In addition to that, salt water also helps to reduce bacterial load in the mouth. Salt creates an environment that is hostile to bacteria, thereby reducing the risk of infection and promoting healing. In a 2014 study, participants were instructed to rinse their mouths with a saltwater solution multiple times daily for a specified period. The researchers found a 44% reduction in gingivitis scores among participants who used saline rinses compared to 20% in the control group. Number 2. Cold compress. If you wrap a few ice cubes or a bag of frozen vegetables in a thin cloth or towel and hold the compress against the outside of the cheek where the toothache is located for 15 to 20 minutes, you can numb tooth pain. But how can it do this? Well, cold temperature can cause the blood vessels to narrow. So applying a cold compress to a certain area reduces blood flow to it. This limits the amount of inflammatory substances that can reach the site of pain, thereby reducing swelling. Adding to that, the cold temperature also numbs the nerves in the affected area, temporarily reducing the perception of pain. This is supported by data in a study published in the Journal of Clinical and Diagnostic Research in 2016. This study investigated the effects of cold application on pain perception and inflammatory response in human subjects. Participants were exposed to cold therapy by applying ice packs to a specific area for 15 minutes. Pain thresholds were measured using a pain rating scale before and after the application. The study found that cold therapy increased pain thresholds, effectively reducing the perception of pain. The average reduction in reported pain was 50% immediately after cold application. Number 3. Hydrogen peroxide rinse. Mix equal parts of 3% hydrogen peroxide and water. Then swish the solution in your mouth for about 30 seconds, then spit it out. It is incredibly important that you don't swallow the solution, and after spitting out the peroxide, you should rinse your mouth with water several times. Hydrogen peroxide is a potent oxidizing agent that kills bacteria through the release of oxygen. When hydrogen peroxide comes into contact with tissue, it releases oxygen in the form of bubbles. This bubbling action helps to mechanically clean the area and reduce bacterial load. And not only does the released oxygen affect the bacteria only, but it can also break down and dislodge plaque and food particles from between teeth and along the gum line, which can reduce irritation and infection. In a study published in the Journal of Dentistry, when participants used a diluted hydrogen peroxide solution as a mouth rinse twice daily for 6 weeks, they reported a significant reduction in bacterial counts by 70% and a 60% improvement in gingival inflammation. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Peppermint tea bag. Steep a peppermint tea bag in boiling water for a few minutes, then let it cool down slightly. Once the tea bag is warm but not hot, place it directly on the sore tooth for about 20 minutes. After that, you can say goodbye temporarily to your toothache. And who does peppermint tea have to thank for all this? Menthol. Menthol is a natural compound found in peppermint that has a cooling and numbing effect on tissues. When applied to the affected area, menthol can temporarily numb the pain and provide relief. In a study, the antimicrobial effects of menthol were tested against common oral bacteria, and its analgesic effects were measured using pain models in animal subjects. Human trials involved topical application of menthol for pain relief. The study found that menthol exhibited significant antibacterial activity against oral pathogens with an 80% reduction in bacterial growth. The analgesic effect was also notable, with a 50% reduction in pain sensation in treated subjects. Number 5. Garlic. Take a fresh garlic clove and crush it to release the allicin, which is a natural antibacterial agent. Place the crushed garlic on the affected tooth. You can also chew a garlic clove if you can tolerate the taste. Then, after a few minutes, rinse your mouth with water. When garlic is crushed, it releases a compound called allicin. Allicin is a sulfur-containing compound with strong antibacterial, antifungal, and antiviral properties. It can help to kill the bacteria responsible for dental infections, thereby reducing pain and inflammation. According to results from a study, allicin effectively killed 70% of tested oral bacteria strains. In clinical trials, participants reported a significant reduction in pain and infection symptoms after using garlic, with 60% reporting complete relief within 24 hours. Number 6. Clove oil. Clove oil is a common home remedy for toothaches. To apply it, mix a few drops of clove oil with a teaspoon of a carrier oil, such as olive or coconut oil. The next step is to soak a cotton ball in the mixture and place it on the affected tooth for about 15 to 20 minutes. Clove oil contains a high concentration of eugenol, which is a compound that acts as a natural anesthetic by numbing the nerves in the affected area. Moreover, eugenol also has anti-inflammatory properties, which help reduce swelling and irritation. Number 7. Vanilla extract. A little bit of vanilla won't just make your dessert taste like heaven, but it can also treat your toothache. Soak a cotton swab or cotton ball in pure vanilla extract and place it on the affected tooth and gum area for a few minutes. Vanilla extract is effective due to its alcohol content. Pure vanilla extract contains alcohol, which can act as a temporary anesthetic. When applied to the tooth and gums, the alcohol can numb the area and reduce the perception of pain. Number 8. Over-the-counter pain relievers. If your pain is a bit more stubborn, you can give over-the-counter pain relievers a shot. Some examples include medications that contain acetaminophen or ibuprofen. Swallow the pill with water or use a pain relief gel directly on the affected area if available. However, it's important to never exceed the recommended dosage, no matter how painful it gets. Ibuprofen works by inhibiting cyclooxygenase enzymes. These enzymes play a crucial role in the synthesis of prostaglandins, which are chemicals that promote inflammation, pain, and fever. By blocking cyclooxygenase enzymes, ibuprofen reduces the production of prostaglandins, leading to decreased inflammation and pain. On the other hand, acetaminophen works by a different mechanism than ibuprofen. Acetaminophen primarily acts on the central nervous system to reduce the perception of pain by inhibiting the synthesis of prostaglandins in the brain. It is effective for pain relief, but doesn't have the anti-inflammatory effects of ibuprofen. In 2013, a study was conducted and published in the Journal of the American Dental Association that compared the efficacy of ibuprofen and acetaminophen in the management of dental pain. Patients were administered either 400 milligrams of ibuprofen or 1,000 milligrams of acetaminophen and monitored for pain relief for 6 hours. Ibuprofen was found to be more effective, with a 60% reduction in pain after 4 hours, compared to a 45% reduction in the acetaminophen group. The study concluded that ibuprofen's anti-inflammatory properties make it more effective for dental pain. So these were the top 8 ways to treat toothache at home. Now, we want to hear from you. Did you try any of them to relieve your pain? How effective was it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.